Welcome to Academics in Nutshell. I am Dr. Jaydeep Choudhury and today I will discuss acute otitis media. A 8-month-old baby boy was having coryza initially, which was followed by cough for the last 5 days. Over the last 2 days, the baby developed high fever, 100 to 103 degree Fahrenheit. And on day 5, the baby became very fussy, was refusing food most often, and most importantly, the baby was waking up crying multiple times at night. Now, in this child, when the systemic examination was done, the respiratory system, the central nervous system, all were normal. Otoscopy revealed a bulged mid-layer that you can see here, the tympanic membrane bulged. So, in this child, the decision about starting antibiotic treatment, or in any child presenting with acute otitis media, the decision about antibiotic treatment depends on 3 factors: severity, laterality, and age. Severity means severe otalgia, duration more than 48 hours, or temperature more than 102 degrees Fahrenheit. Whether it's unilateral or bilateral, whether the age is below 2 years or above 2 years. So based on these 3 factors, the antibiotic, whether to start or not, is decided. In children less than 6 months, for any acute otitis media, antibiotics has to be started. In the 6 months to 2 years age group, if it's a severe acute otitis media, as per the definition I just told, be it unilateral or bilateral, antibiotics have to be started. If it's a bilateral acute otitis media without otorrhea, antibiotics has to be started. Only if it's a unilateral acute otitis media without otorrhea, one can wait and watch for 48 hours, and antibiotics has to be started if the symptoms persist beyond 48 hours. In children above 2 years, if it's a severe acute otitis media, unilateral or bilateral, then only antibiotics has to be started. Otherwise, in other conditions, one can wait and watch for 48 hours. Now, irrespective of age, if there is otorrhea due to acute otitis media, then antibiotics has to be started. Now, the point is that to decide about the antibiotic, one has to think of the organisms causing acute otitis media. The commonest 3 organisms which cause acute otitis media are Streptococcus pneumoniae, non-typeable H. influenzae, and Moraxella catarrhalis. For this, the antibiotic of choice is amoxicillin, 40 to 50 mg per kg per day in divided doses for 10 days. Now, if amoxicillin is not available, then as a substitute, one can start co-amoxiclav with amoxicillin at the dose of 40 to 50 mg per kg. But specific indications of co-amoxiclav, and particularly high-dose co-amoxiclav, 80 to 90 mg per kg per day for 10 days, is indicated if the child has received antibiotic in the last 30 days, or has concurrent purulent conjunctivitis, or there is history of recurrent acute otitis media unresponsive to amoxicillin. So these are the indications of co-amoxiclav and high-dose co-amoxiclav. Now, if there is penicillin allergy, non-type 1 reaction, then cefdinir is the drug of choice, or if it's a type 1 reaction, when the person is allergic to penicillin and cephalosporin group, then one can go for macrolides or quinolones. Tympanocentesis is indicated only in those who fail the second-line therapy. The second-line drugs are cefodoxime for 10 days, or injectable ceftriaxone for 3 days, or levofloxacin for 10 days. Regarding eardrops, well, it's debatable, but definitely the mixture eardrops are not indicated. Only if there is severe pain, one can go for analgesic eardrops. So thank you. See you again in this series.